This week I'm on the afternoon shift. The benefit of starting at 1 in the afternoon, I get to sleep in. Gotta love that. Now who will I be looking after today? She's great. Such a good sense of humour.
Good morning, Shannon.
Hi, Connie. Have you got my rooms today?
I do. How's your night been?
Really good. You have a good shift.
Oh, good.
Did you want handover of Mrs. Smith?
Oh, please.
Time for handover, so I know how patients have been doing earlier.
All right. Do you know her at all?
No, I haven't actually. Hey, excuse me, Cheryl.
Sorry, Connie.
Yep, just 2 seconds. Okay, thank you. Bye. Can I just ask you a couple of questions
Sure you
about
can.
my patient?
Yep, no problem.
Mrs. Smith, what's the plan?
For extra information, I'll go to the coordinator.
Mrs. Smith's going to go for a CT scan first, and then she actually needs a nurse escort as well. So if you could go down with her, that'd be great because of her trachea, and just make sure you remember to take your trachea gear and all that sort of stuff. Yep.
If I'm not sure about a condition, I can ask a staff development nurse.
Good morning, Leonie.
Hi Connie, how you going?
I'm good, thank you. I'm a bit stuck. Can I
Yeah, sure. What's
pick
up?
your brain for a moment? Mrs. Smith, she's the subarach lady, and she's got the trachea incisate.
Yeah.
She's going for a CT scan.
Yeah.
What do I need to bring with me?
Where's
and
she going down Shan's?
No, just
Okay.
scan downstairs. Yeah.
Just make sure you've got some tracheal dilators and also a spare trachea just in case it comes out. You need to put another one in. So usually you go for the same size and one smaller. And just make sure the elderlies come with some suction and oxygen equipment.
I hope Mr. Garrett is feeling a bit better today.
Good morning, Paul.
Hi, sister.
How are you feeling today?
Still that pain in my leg,
Still got pain in your leg? Are you having analgesia for that?
Yeah, a bit of painkiller.
And is it working?
Not really that well.
No?
No.
Oh, we'll have to get the doctors onto that.
Yeah, okay, thank you.
It's in my nature to be friendly, and it's important because it builds rapport between myself and the patients under my care.
Beautiful. 110/40.
Observations form a large part of my day. The ability to assess while communicating is an important skill to have. It not only makes the job more enjoyable, it also helps me pick up changes in a patient's strength, attitude and medical status.
That's good. Nice and strong.
I work in conjunction with enrolled nurses. There's really not a lot of difference between us. RNs go to uni and do heaps of theory, whereas ENs attend TAFE and do more hands-on work. In the workday, our tasks are very similar. However, only registered nurses can give IV medications. There is procedure and protocols that I must follow when preparing some IV medications. They must be reconstituted appropriately as stated by their guidelines. Identification stickers are then put on the bag and countersigned and counter-checked so that all information is backed up and accurate.
This is for Mrs. Smith.
Yeah.
In your order. Not to Dementon. There you go.
Thank you for that.
They are, Connie. That's the oxycodone for Mrs. McEnroe. It's 2 hourly PRN.
Oh, wonderful. Thank you for that.
No worries.
This is Jennifer Gibson. She's had some codeine phosphate at 6:30 this morning.
DD drugs or drugs of dependence have their own procedure. Whenever I and another nurse remove any from storage, I must write the quantity in the DD book to keep a record of their use.
30 to 60. Last time at 6:30. Okay. Codeine phosphate. Yeah, thanks. Okay.
Yeah, tablets. Got it. Okay. Let me just go up to see the...
Some of the equipment I use includes the bladder scanner. I monitor test results of patients and then follow instructions the doctor has given. Now, what has the doctor prescribed for Mrs. Fuller? Flucloxacillin 2 grams, IV, QRD for 48 hours. I interact with many professionals in a wide variety of fields here at Royal Perth.
I'm just wondering about Mr. James White, actually. He's
He can do an independent sit-to-stand transfer. He's non-weight bearing on his left leg, and he's
Have you done a bladder scan?
Yeah, there's 800 mils in there.
Okay, why don't you put an indwelling catheter in for me?
At the moment, she's coping really nicely on puree and level 1 thickened fluids, so sort of about the consistency.
To become an RN, I did a bachelor degree in nursing. I was attracted to nursing for a number of reasons. I knew I could travel with my job throughout Australia and overseas. There are also heaps of career paths to follow, and I can advance my career with further study. I love the personal side of my job the most, the great staff I become friends with and have fun with, also the various patients I get to know and care for, if only for a short while. I hear you'll be going home in a couple of days.
Bonus.
How
Been
awesome
waiting.
is that?
I've got to say it's good. I've been waiting for a while.
It's about time.
It is. A couple of weeks in here is long enough.
Are you going back to my old bar? Sometimes it can get a bit sad. We build a rapport as I go through the stages of recovery with them.
Thanks, Connie. Thanks for looking after me.
Pleasure. It's really satisfying to see them back on their feet and heading home to their families. That's the part of my job that I find most rewarding.